So as the debate over pharmacare sharpens in this election campaign, what is the right model for Canada? Do we need a better way to ensure Canadians get the prescription drugs they need? Let's bring in three guests now to talk about that. Dr. Danielle Martin is the Executive Vice President and Chief Medical Executive at Women's College Hospital and Associate Professor at the Munk School of Global Affairs and Public Policy at the University of Toronto. Good to see you. Dr. Brett Skinner is the CEO of the Canadian Health Policy Institute. And Dr. Adam Kassam is a physician and the chair of Physical Medicine and Rehabilitation at the Ontario Medical Association. Thank you all for being here for this important conversation. And if I can, I want to start by hearing from each of you, and I'll start with Dr. Martin, on the importance of a universal single-payer pharmacare plan for Canada. Where does that rank as a priority for the healthcare system?
I think for the healthcare system, it's priority number one, given the critical need for federal involvement in this particular issue. So we know that Canadians, there are huge numbers of Canadians who cannot access their medically necessary prescription medicines. And yet at the same time, we're spending 30% more than the OECD average on drugs in Canada. And we ironically have huge numbers of Canadians who are the victims of overprescribing and inappropriate prescribing. So this is an area that's affecting Canadians' health in a wide variety of ways, and it's an area that is ripe for intervention where really federal leadership is critically important. And that's why for those of us who work in healthcare every day, I think it's probably priority number one when it comes to healthcare policy in Canada.
All right, Dr. Skinner, let me turn to you. Where do you stand on that question? Is a universal pharmacare system the most urgent priority for Canada's healthcare system?
No, I think our existing system is actually working quite well, but there are some gaps that we need to fill, and I think that's a better approach than taking the whole system and throwing it away and starting over with a national universal single-payer system. I like to say that it's unnecessary, bad for patients, and costly for taxpayers to have a single-payer and a national pharmacare system. The reason I say it's unnecessary is because the country already has universal catastrophic coverage through a variety of safety net programs in all the provinces. And there's public drug plans that cover seniors and low-income social assistance recipients. And 23 million Canadians receive their benefits through private drug plans. So really we have universal coverage now. Where the gaps really occur is in formulary exclusions, that is in public drug plans that don't cover all new drugs that are approved by Health Canada. And that's where the gaps are really occurring.
All right, want to come back. We'll come back to some of this, but let me hear from Dr. Kassam. What's your view on this?
Thank you so much. Thank you so much for having me, Peter. The reason why a conversation about pharmacare is so important in this country right now is, as Dr. Martin alluded to, there are many Canadians across the country, and the number might be up to 1 in 5, who have difficulty with affording their prescription medications. And so while we have this represents an opportunity to really improve upon our healthcare system. And while having a conversation about the concept of pharmacare is important, just as important are the details about what any kind of plan would look like moving forward for all Canadians.
Sure. I mean, let's jump in. Dr. Martin, jump in there. Then so if we know some people can't afford prescription drugs, we've heard the other side of the argument that, look, just fill the gap. So what's the answer to those who suggest, and we're hearing it, just develop a plan that covers people who don't have coverage and leave the rest the way it is? What's the response to that?
Well, in fact, a lot of the people who aren't filling their prescriptions already have some form of coverage, and yet they can't afford the co-payments, they can't afford the deductibles. And remember that each of us who thinks that we have coverage, you have a private drug plan through your employer, each of us is only a diagnosis and a job loss away from being stuck in the same situation as the taxi drivers and the nannies and the self-employed people of this country. And so what you end up with is a situation where people are dependent on their employment for having access to drug coverage. But of course, one of the first things that happens when you get sick is it threatens your ability to work. And so in the real world, in the real healthcare system where sick people are showing up in the emergency department because their asthma or their chronic lung disease is out of control because they're taking their puffers every other day, or their blood pressure's out of control because they were waiting for the check to come in at the end of the month to fill their prescription, those things have real consequences for people's health, and the complications get dealt with in our healthcare system. So why should we not just fill in the gaps then and deal with the people who don't have any drug coverage at all? One of the biggest reasons is because that is the most expensive way to deal with the problem.
All right.
So we're going to either pay publicly or we're going to pay privately for our drugs. It is way cheaper if we all go in together.
What's your response to that, Dr. Skinner?
Well, I think quite the opposite, that national pharmacare would be very costly for taxpayers.
Well, we're hearing numbers around $20 billion by the time a plan would be fully implemented, but is that necessarily more expensive than the money that's in the system now for drugs?
Well, the savings that I think Dr. Martin is referring to, according to the parliamentary budget officer who did an analysis of this, would come largely from rationing and price regulations. And I think some of it is involving a lot of rosy scenarios. Even so, it would transfer $20 billion to the federal budget off of provincial budgets and out of the private sector. And that includes $7.5 billion in new additional expenses for taxpayers. So really, we're talking about a cost shift, not a cost savings. And there's additional cost to patients. The public drug plan proposed by the parliamentary budget officer was based on Quebec's public drug plan formulary, which only covers 1/3 of all new medicines. And private drug plans cover almost 100% of new medicines. So there's a drastic difference between private drug benefits that are offered in Canada now versus what would be offered to Canadians under national pharmacare. And 23 million Canadians would have to accept more inferior benefit levels.
I guess that's for people watching, Dr. Kassam, the bottom line is, what is the best option for patients? Because that is the bottom line for patients. Will a universal pharmacare plan give patients better access to the drugs they need?
I think the intention behind a pharmacare plan comes from a good place. It identifies a deficiency in our system and potentially offers a solution. I think what's unclear at this point in time is what kind of plan would be best for our country moving forward. And for the report itself, it would have been nice if the council had provided a side-by-side comparison of all of the different options they were considering, both from a cost perspective as well as from a health perspective. And this would have allowed Canadians, I think, to be better informed in order to make a decision at the ballot box in the fall.
So what more do they need to know, I guess, is the question.
I think knowing a little bit more about how much cost savings are in place. And one of the important points I think to recognize here is there's a quote about the forecasted savings of about $5 billion for prescription drugs,
right,
which is a significant number, but we should also recognize that that is a theoretical savings. That is something that it depends very strongly on the success of negotiations between the Canada Drug Agency and pharmaceutical companies. Mm-hmm. And as Dr. Skinner alluded to, there is also the potential that certain pharmaceutical companies may choose to take their business elsewhere or not sell certain types of medications to the Canadian market. So while there is an advantage for, let's say, bulk buying in terms of reducing the price for drugs, it's also important for Canadians to recognize some of the risks of implementing a national program of this nature.
Dr. Martin, let me hear you on that if I can, in terms of the notion of cost in the conversation and the suggestion that under a universal publicly paid single-payer pharmacare plan, people might actually have less access to the drugs they need.
So I think what people want, what patients want, and certainly what healthcare providers want, is for people to get access to the drugs that they need. And so do we want plans that cover everything for everyone all the time? The evidence on that is actually very clear. We don't. We shouldn't want those plans because those plans are part of what contributes to overprescribing and inappropriate prescribing that leads to medication errors, to unnecessary drug interactions, to seniors falling and breaking their hips and ending up in the hospital. So what each of us should want for ourselves and our own families is a drug formulary that's actually based on evidence, that gives us access to the things that we need, but that also tries to guide prescribing behaviors so that people like me don't inadvertently give you a prescription for something that's going to cause you more harm than good. And that's actually a complex conversation, not one that's easy to distill in a debate over, political platforms. What you want is to know when you're going in the ballot box that the party you're voting for is willing to put in place intelligent and thoughtful processes and procedures where we're making decisions about what we're going to pay for everybody based on evidence and not based on threats from the pharmaceutical industry, and that are going to ensure that people can get access to the things that they need, but that are also going to protect us from things that could cause us unnecessary harm.
Dr. Skinner, let me hear you. I know you want to jump in, and on the access question, if I can, does a universal publicly paid pharmacare plan guarantee better access to the drugs people need?
No, not versus the current system. It doesn't. For 23 million Canadians who have private drug benefits, they would be taking a much smaller, more narrow list of drugs that would be eligible for coverage under pharmacare versus what they have now. That's a substantial difference. And I think that we have to look at the cost of the alternative. We're talking about the cost of a single payer system, which is substantial. What's the cost of the alternative to fill the gaps? I've done the analysis, and it's about $2.5 billion for existing public plans to come up to the Quebec drug formulary level. Most plans in the country are below that. And it would only cost $2.5 billion for them to come up to the Quebec level. And that leaves the private sector drug plans alone, so there's no disruption. And we end up with better drug coverage in existing public drug plans across the country. And we can add another $2.5 billion and come up to the private sector level for a total of $5 billion versus a $20 billion transfer to the federal government.
All right, Dr. Kassam, so where do you find yourself coming down on this conversation then, based on everything we're hearing?
Yeah, so as a doctor, we are often told, and our goal is to really practice evidence-based medicine. And as policymakers, I think we should use the same approach. And what I mean by that is we should be trying to learn from previous attempts at a pharmacare program or other programs across the country. So for example, I bring this lens from Ontario, which was last year in 2018, OHIP Plus was rolled out across the province.
Right.
And there were a significant number of unintended consequences for patients. So for example, there were children who were on medications who were either forced to switch medications or lost their coverage as a result of this implementation. And so any program that we roll out across the country needs to be patient-centered and needs to try and mitigate any unintended consequences for the patients whom we serve.
Right, but Dr. Martin, can you do that? I mean, can you build a plan that ensures that the examples Dr. Kassam has just given don't happen?
I mean, I think we've got to try, right? We don't, I mean, the alternative is to leave ourselves in a situation where some people are getting too much medication and a whole lot of people can't get access to the very basic things that they need to manage their chronic diseases. So let's not paint too rosy a picture of the situation that we're in now. Anyone who works in an emergency department in a Canadian hospital, anyone who works on a ward in a Canadian hospital can tell you that people are suffering as a result of the crazy system that we have right now. And actually, we're all overpaying. So I don't think anybody thinks that we're going to do well by continuing under the structures that we've got. Whenever you put a new plan into place, you have to pay very close attention to what the potential cracks in the transition are going to be. And I think we learned some important lessons from the OHIP Plus implementation. And actually, a lot of them were fixed quite quickly thereafter. And so, any transition is going to be bumpy, but let's not pretend that the situation we find ourselves in right now is one that's tenable for Canadians. I think when we go to the ballot box and when we're talking about an election, what Canadians want to look for is, are political parties taking a stance on pharmacare? Is it clear what their stance is? And are they considering more than just making sure that everybody gets covered? Are they also considering how we're going to get prices down to be more in line with every other industrialized country in the world? And are we going to do something about overprescribing and harmful, inappropriate prescribing? That's what a real comprehensive pharmacare plan looks like, right. And that's what we should be demanding of our political
I want to hear from our other two guests to finish up here in this context here. Here's what the major parties are saying about pharmacare. The Liberals have promised some form of national pharmacare, but have not committed to a universal single-payer model. The NDP is promising universal pharmacare and promising to do it quickly. The Green Party supports it. The Conservatives favor coverage for those who can't get drug coverage through private plans. So, Dr. Skinner, what should voters be considering if this issue is important to their vote?
Well, I think voters have to consider the changes in their drug benefits that they enjoy now. What will happen to those benefits under a national pharmacare system? And taxpayers have to consider how it's going to impact their pocketbook. And I think we also have to consider access to future innovative products. I personally suffer from Parkinson's disease, And my particular form of Parkinson's disease is non-responsive to existing pharmaceutical treatments. So it's rare that that occurs, but for me, that means that I'm waiting on the edge of my seat for the next generation of innovative medicines to come through the pipeline. And then I would need to have access to those drugs when they are available through my insurance plans, whether they be public plans or private plans. And so these issues are important things for voters to consider. How does it impact your pocketbook? Are there cheaper alternatives to achieving the same goal? How does it affect my access to drugs currently, and how will it affect my access to drugs in the future?
All right, what do you think voters ought to consider, Dr. Kassam?
So I think it's important that Canadians understand that any national pharmacare program that we move forward to, and if that's what we choose to do as a country, will be dependent on our political leadership. And so that will depend very significantly upon the relationship between the federal and provincial governments. It will depend on the composition of Parliament moving forward. And so this is why every election, including the one in the fall, is very, very important. I'd like to also add that as a rehab doctor, we see patients with a number of needs. So for example, last week I saw a patient with a stroke, and they had lost the ability to use their arm and leg, as well as had issues with communication. And so not only was the drugs that they were on important for their, let's say, for example, secondary prevention, but their physiotherapy and speech therapy was also important. So there are services that are currently underfunded in our country and in our system, and we have to have an honest discussion in our country about what our priorities are, what we choose to fund, and the extent to which we do that, because there are a whole host of needs that Canadians have. And pharmacare is just one of that spectrum of needs.
Yeah, we focused our conversation on that, Dr. Martin, but there are clearly lots of other things that the party should be talking about as well when it comes to healthcare, right?
Absolutely. And I think, actually, virtually every conversation that we're going to hear over the course of this political campaign is a health conversation. The climate change conversation has huge impacts on health, from, asthma exacerbations to the impact of wildfires and extreme temperatures and access to the food supply. Climate change is as much about health as it is about other factors. So is the economic conversation about how we're going to make sure that our economy grows effectively and that people can get jobs, because income is the most determinant of health. I mean, actually, a lot of these things are not health care, but they're all health conversations.
All right, and look at thank you all for the conversation on this issue today. It's been good to hear from all of you. Appreciate your time today, all of you. Thank you so much, Danielle Martin, Brett Skinner, and Adam Kassam. Thank you so much for taking the time to broach this subject and get into some of the nuts and bolts of why this issue matters to Canadians and should matter to Canadians. Thanks again.
Thank you.
Glad to be here.
Thank you.